Dr. Cassie from NAVC's Vetfolio and the host of Vet to Vet. It's a daily part of a veterinarian's life to help animals with breed-specific medical issues. And today we're focusing on brachycephalic dogs. Super cute and known for having a host of health concerns. Here to talk to us about strategies for care and communication is Dr. Jules Benson. Dr. Benson is a graduate of the University of Liverpool's School of Veterinary Medicine. He's been active in conservation efforts in Africa, and he worked in clinical practice before moving into the pet health industry as a leader. Dr. Benson, it's so great to talk to you about our brachycephalic friends here today.
It's great to talk to you, Cassie. This is a topic that I and many of my team are really excited about, and trying to get the word out there and trying to help clinicians and clinical teams have great conversations is kind of the goal for us.
Absolutely. I think, we can all kind of tell there's something there, but really excited to talk about the research and what we really know about these breeds as they become more and more common.
Yeah, for sure. And when you talk about common, I've been out of practice for 10 years or so now. And so it's funny hearing people talk about Frenchies, and it wasn't until we looked at the data, things have changed. I was in practice more than 10 years ago. When you look at the numbers, I don't remember Frenchies being that popular. We looked at our breed rankings, and 10 years ago, Frenchies were 19th out of all the purebred dogs that we see. And now they're third among all of the purebreds. Golden's at the top, obviously, but it's been a huge surge. So brachycephalic breeds overall, we're not ensuring that many more brachycephalics, but the number of Frenchies has increased fivefold over the last 10 years.
That tracks about right. I saw one yesterday for a neuter.
Yeah.
So one of the terms we talk about when it comes to brachycephalics is extreme brachycephalic. So can you talk about the term extreme brachycephalic versus non-extreme brachycephalic and why distinguishing between the two is so important?
So it was really interesting when we came to this. We came with, how are we going to determine which breeds are brachycephalic, right? So we can name the top candidates off the top of our head, right? We can name French bulldogs and pugs and English bulldogs. But as you get down the list, is a Chow brachycephalic? Is a Boston a brachycephalic? Is a Chinja brachycephalic? And so when we're making those distinctions, we needed to have some kind of really solid way of looking at that. So we looked across about 15 or 20 peer-reviewed papers and basically said, we will, if they're in 3 or more of these papers and references a brachycephalic breed, we will include them in the study. And so there's things like, there's not the old Victorian bulldog, like that's not in there because it wasn't referenced in the studies, even though that could be a brachycephalic breed, and it wasn't included because it wasn't in the studies. What we found as we started to look at the data is that some of these breeds jumped out at us, and we went back to the peer-reviewed research and said, are they distinguishing between any breeds differently? And we found, and we used the same rationale and said, okay, we're finding this term extreme brachycephalic, and just in terms of the extreme, physical characteristics of them. And we said the same thing. If they're referred to as extreme brachycephalic in more than 3 papers, we'll include them separately. And it came out of the data as well. We were really seeing massive changes, and we can talk about this, but we're seeing massive changes among these extreme breeds that distinguish them massively from a clinical point of view from the rest of the brachycephalic breeds.
I feel like my brain is just spinning. I have all these questions and I'm like, tell me all the things, because it logically makes sense based on what I see clinically. So I'm really interested in what the data says. Can you tell us about some of that research that's been done to suggest that there truly are important medical differences between an extreme brachycephalic and a non-extreme brachycephalic?
I think that the one that jumped out for most of us was when we talk about brachycephalics, we talk immediately about brachycephalic obstructive airway syndrome, right? So that syndrome that is characterized by stenotic nares, everted laryngeal saccules, elongated soft palate. So, this is something that we see in clinical practice. Now, BOAS is one of the more serious things we do, and it increases not just risk for, other diseases like pneumonia, which we'll talk about as well, but also, from, doing a neuter on a French bulldog, how, as you're approaching that, is that the same as a neuter that you're doing in any other dog, or do you have right? So you're more worried about the anesthetic risk, you're more worried about the recovery. Like, there are just things that make this more complicated. So clinical BOAS in and of itself, and we determine that by has someone submitted a claim for their pet for BOAS. And so one of the great things about our data is that they're not just sending us an invoice and we're paying it. They're sending us an invoice and we're saying this is the disease it is. So we know that this claim is for BOAS. We know this is for pancreatitis. We know this is for IBDD, right? So that gives us the power to actually look at those on the back end and say, how common is this among this breed? So the thing about BOAS is that it doesn't exist in the rest of the population. That's something we have to remember. If you're looking outside of brachycephalic breeds, it's not there. So when we looked at how common brachycephalic obstructive airway syndrome was in Frenchies or in other extreme brachies, we were only able to compare them to the rest of the brachycephalic breeds. So compared to the rest of the population, brachycephalics, Frenchies have a million times a greater risk of brachycephalic obstructive airway syndrome. But even among brachies, they're 17 times more likely to submit a claim for BOAS than other brachycephalic, non-extreme brachycephalic breeds.
Wow, I think that's a really powerful number there to say 17 times more likely in one specific breed.
Yeah. And even the English bulldogs and the pugs, which are the other two extreme brachies. So English bulldogs are about 12 times more likely, and pugs are about 10 times more likely. So again, thinking back to the other breeds we have boxers, we have some very popular breeds, boxers, cavaliers, these guys are not affected in anywhere near the same way, despite having that, flattened face.
And I'm really glad to hear that there's data out there discussing this, because like I said, I think that really fits with what we're seeing clinically in these guys.
Yeah. And the syndrome itself, I mean, another thing we can look at the data is, when is this occurring? And so it's funny, pugs kind of jump out of the data as being the healthier extreme brachycephalic, right? So they're only 10 times more likely to get it instead of 17 times more likely, but their age spread is also different. So most of the French bulldogs will present with this disease before the age of 2. Whereas with pugs, that stretches out to almost 4. So just distinct differences in the clinical presentation of these diseases across these breeds as well.
This is so interesting. I'm so glad we're having this conversation. And we're focusing on BOAS here in the beginning. What other types of medical conditions are we worried about in these extreme brachycephalics?
Well, and it's interesting. So when we started looking at respiratory disease, is okay, respiratory. I always try and, what are the words I can say and which words I can't, with the funny accent. So when we look at respiratory disease,
we know what you're saying.
When we look at respiratory disease, one of the reasons we really looked at this distinction with extreme brachycephalics was, if you just lump all brachycephalic dogs together, overall, they're about 3 times more likely to have a claim for respiratory disease. So that includes BOAS, includes pneumonia, right? But then when you break those out into extreme versus non-extreme, the extremes actually go to 5 times more likely than non-brachycephalic dogs. But the non-extreme brachycephalics are about the same. So they're not having these respiratory issues. However, when you look at things like ocular disease, brachycephalics overall are about 4 times more likely to have an ocular problem, which, again, and I wasn't familiar with brachycephalic ocular syndrome, BOS, before doing this research. But, we know what those exophthalmic breeds are. We know that they have, increased trauma. We know they have increased entropium. We know they have, all those eyelid diseases, increased cherry eye. The ocular diseases, they're 5 times more likely in extremes, but they're still 3 times more likely in non-extreme brachycephalics as well. So there are some distinctions. There are some areas where we say other brachycephalic dogs do still have issues there. It starts to become a little bit more serious when you look at things like hypothermia, for example. So you could imagine the extreme brachycephalics have a lot more trouble regulating temperature, and so they're 5 times more likely than non-brachies to have a claim for heat stroke. They're 4 times more likely to have claims for complications of pregnancy, and they're 3 times more likely to have complications with neurological disease, so IVDD and others, right?
Goodness gracious, this is a lot of a lot of things that we really need to keep in mind.
Well, and I think that the last one, we have another paper coming out on intervertebral disc disease, hopefully later this year. But it was interesting to start looking at those numbers. We did some studies on senior dogs. We released the first version of that late last year, sorry. And IVDD was part of that. We didn't publish the data because it was so compelling and so big that we wanted to turn it into its own paper. And I was surprised coming up through vet school, and I don't know if it was the same for you, but the Dachshund was the poster child for IVDD. And I remember a clinician telling me, and I don't know how correct the stat is, but it felt true, was that Dachshunds have 10 times the number of cases of IVDD than all of the dogs put together. And so I was like, okay, Dachshunds. And again, not having as many French bulldogs in practice when I practiced, I wasn't aware that people are now seeing, and the data showed this. The data show that Dachshunds and French bulldogs are neck and neck, if you'll excuse the pun, for IVDD. So, and the neurologists that we talk to are actually saying that they're more extreme cases. They're harder to manage. They're often more advanced. There's often more extreme changes taking place. So this is something that I wasn't aware of clinically till I started looking at the data.
Yeah, and again, it's really interesting to hear the data, because I would agree that I started practicing. I've been out 9 years, and I would agree I was mostly seeing dachshunds, and I have felt like I'm seeing it more in these brachycephalics. And I'm thinking of one patient in particular who, we managed medically, was ambulatory, and all the indications to kind of manage medically in the beginning. And he ended up getting referred. He's doing well, but he ended up getting referred to neurology because he just wasn't responding the way that I'm used to seeing dogs respond to medical therapy in the condition that he was in. And so that makes sense what you're saying, that it's a little bit harder to manage. It's a little bit more extreme. It's different from what we've seen in the past.
Well, and the second part of the research we can talk about is, are the dogs with BOAS, are they more sick with other things? And neurological disease is one of those things. So if you look at dogs with BOAS, they're actually going to be more likely to get things like spinal disease. So spinal disease in French bulldogs is twice as likely in dogs who have BOAS. It's 4 times as likely in English bulldogs with BOAS. And so those you're already selecting breeds who have massive predisposition towards this condition. And you're saying if you have a respiratory syndrome, you're also more likely to get spinal disease, esophageal disease, pneumonia. So these dogs aren't just sick in one area. These physical characteristics that are being selected for seem to be correlated with increased sickness in other areas too.
I mean, it's kind of sad overall to think about, take BOAS, for example. Like you said, it only exists in this breed of dogs. If that, take that breed of dog away, the disease doesn't exist. And, it's really sad to think about, these pups that are affected with some pretty serious medical conditions. So I guess my next question would be, what do you see as the path forward here, considering the popularity of these breeds among household pets? It's hard to deny that they're cute and they're sweet, and they have all these positive characteristics, but I think it sounds like we need to really take the medical aspect very seriously.
And it's hard because it's not every dog, right? So I think it falls into, my grandfather smoked until he was 95 and never had any issues, right? There are people out there with French bulldogs who've had great experiences, no medical issues. But from a clinical point of view, we see so many who have serious medical, need serious medical help. And it's not like a flat-coated retriever where, those dogs are, they get terrible cancers at age, 5 or 6 or whatever. That's a terrible, kind of genetic confluence. These are diseases that can hit them, as I said, as early as, 1 and 2, and they're lifelong issues. Respiratory disease, neurological disease, and skin disease we haven't talked about, but that's in there as well. These things require management, and they also require the person to have more awareness of what's going on. We talked about heat stroke. We talked about their ability to exercise, healthily, et cetera, et cetera. So I think it's because it's such a potential added burden to everyday life with these diseases. I think it's important that we have these conversations. So that's some of the reasons that we're trying to get the data out there, so that we can have meaningful conversations either early in the pet's life, so they can know, hey, let us know if you're seeing signs that could be associated with early BOAS. And there are some great studies out there now showing, for example, that early surgical intervention could actually prevent the progression of the disease. That the EVA laryngeal saccules are usually a progression of the disease, as is some of the pneumonia. How do we, potentially get in front of that, right? So are there ways that we can use these data clinically to have better outcomes, but also to have more meaningful conversations with families about what are the pets that I want to share my life with? And I think French bulldogs are super charming. They've got great personalities. But I think there's a question of, are there other dogs that have great personalities that aren't necessarily going to have potential welfare concerns, frankly? And I think that's what this is. I think some of the issue societally comes from normalizing the snoring and the snuffling and the respiratory disease as cuteness and part of the breed. And I think kind of coming back to that and saying, this isn't a normal clinical thing. Like, other dogs don't do this, and this is a sign of illness. I think those are conversations that we have to have.
And I'm glad that you said it, because I think that needs to be said, that like we shouldn't be normalizing this, because this is a pathological condition that can lead to a lot worse conditions over time, over this pet's life. Yeah. Thinking about sitting in an exam room with an owner, I mean, that can be a really tough conversation to have there, especially you have this cute little wiggly butt Frenchie walking around, and this owner who loves them to pieces. And, we're having these difficult conversations. Do you have any suggestions for how to approach that and how to make that a good, productive conversation?
Well, I think what we're trying to do with the data, and it's funny when when we have these conversations and they're posted on social media, and people react viscerally, right? And they say, "Hey, these are great dogs," and nobody's arguing with that. Like, I think people, and the French bulldogs that I saw in practice, they are very charming dogs, and like as are 99% of dogs, frankly, right? I think coming to it from a place of data really helps us because it takes the judgment out of the argument and basically says, hey, look, you need to see these things, even if it's just from a clinical point of view, saying you need to be aware that this is a massively increased risk for this dog. And I need you to watch for this, and this. I think coming at it from a place of, instead of saying, I've seen, my experience is, and my opinion is that this is a problem and these dogs are a problem. If you're coming at it from a place of data and saying, we looked at 450,000, dogs, and the data show very clearly that these dogs have issues. So whether that's when they have the dog or when you're able to have a conversation with them about the dog that they're selecting, I think being able to just point to something and say very clearly, hey, there's a thing going on here. This isn't my opinion. This is a massive study of a population of dogs, and this is what we're seeing.
Hard to argue with 500,000 dogs.
It is and it isn't, right? Because people want to do what they want to do, and I think going back to your point earlier, how do we change this? It's got to come from the consumer side, to my opinion. I think as long as there's money in people selling French bulldogs or other breeds, I struggle with. I think breeder programs are fantastic. I think that what OFA is doing around some scoring around brachycephalic breeds, I think that's a great step in the right direction. I just the consumer push to say either go to a breeder that is doing this screening if you really want this breed, or consider another breed, because if you're going somewhere else, chances are there haven't been good health checks. There hasn't been the desire to breed healthy dogs to healthy dogs. I think to me, it has to come from the consumer side. And I think because we are still, as veterinarians and veterinary healthcare teams, the most trusted resource for pet families, I think we have to have, more in our arsenal to be able to have those quality conversations.
And that makes a lot of sense. And thinking about that as being a resource to help influence the consumer side of things to have healthier dogs and breed healthier dogs.
Yeah.
Especially, like you mentioned, being this trusted resource in this position of trust to maybe help influence the consumer side to say, hey, this is why it's so important that we're breeding healthy animals so that we're not dealing with all of these pathologic conditions throughout their life. We kind of were talking about the path forward. Do you have suggestions for just how we as a profession, rather than, in the individual exam room, how we as a profession can influence that course and help spare owners some of the expense, some of the heartache that can come along with these conditions?
Yeah, and I think, again, it's easy to point fingers at who could and should be doing things right. But I think looking at what the British Veterinary Association, and I might be biased, but what the BVA have done in the past about things like ear cropping, things like brachycephalic breeds, having veterinary medicine at large, have more quality conversations about what do we really believe are welfare standards and what do we think should healthy dogs be, or what should healthy dogs not be, perhaps is more clear. And I know it can be difficult to get into those conversations, and there's a lot of backlash, and obviously everybody has an opinion. But I think unless we're willing to have those conversations, things will continue the way they are, right? We're not going to see, declawing, I think, is a great example, right? And we've seen municipalities and I think some states looking at banning declawing. Now, and that could be, we could see breed specific legislation around brachycephalic breeds, but quite frankly, that's not going to happen, right? We're not going to get regulatory pressure. The easiest way to change anything is through regulatory pressure. I don't think we're ever going to see that with these breeds, so it has to come from somewhere else. So I think we as an industry are still a trusted voice in this conversation. Being able to have reasonable and rational conversations about these things that are informed by data, I think that's the best we can do. And again, we can only appeal to, I think, people's needs, trying to have that conversation exactly as you said about what is down the road. And I think preparing people for not just the potential financial needs of these pets, but also the emotional and the physical needs that might come down the road. As with any pet, every pet is a responsibility, but just helping people understand that the responsibility might be increased with certain breeds because of the predilections they have.
Absolutely. And talking about these data-driven conversations, you mentioned OFA doing some brachycephalic scoring. Can you elaborate on that a little bit?
So my understanding is that they're starting to do some scoring around stenotic nares. They're starting to say, and I don't fully know the heritability of these factors, but I would have to assume that if you're breeding healthy dogs to healthy dogs, there are greater chances of having healthy dogs. So I think just having any measure of scoring and having breeders who, and we saw this with, and again, whether you're a fan of OFA hip scoring or pen hip or anything else, I think anybody who's taking the measures to try and do those things to show that they are breeding healthy dogs. Because I think there's also among the veterinary industry, we can be quite not scared, but we can be a little cautious around the breeding, area, right? I think we can many veterinarians have had conversations around, well, my breeder says this about this. It's like, well, I'm just a veterinarian, so what do I know? But
Right.
but I think there are great breeders out there. I think there are breeders who really want to do the best thing. And very frankly, most of those breeders are not making very much money. They're usually doing it because they love the breed and they want to get those dogs out there. I think the danger is that we're seeing so many breeders who are not looking at this from a animal welfare point of view. They're looking at it from a commercialization point of view. And as long as that's a pressure, there's always going to be those people, right? So I think we try, and again, I know that in the past, we've had campaigns around, how do you choose a good breeder? How do you have those good conversations? And I think we as organized veterinary medicine should continue to keep putting those things out there. It's never going to be enough. We're always going to have more work to do, but I think having those conversations is really important.
That makes a lot of sense. The other thing I wanted to ask you to elaborate on a little bit more was you were talking about, I think you called it like prophylactic or early intervention surgery with these guys. Can you talk about that a little bit more?
Yeah, there's not a lot of research out there, but we a couple of the sessions that we had at NABC, actually, we spoke on this, and we had some researchers come up to us and say there's one researcher from Brazil who says specifically they've been doing early intervention surgery with these dogs and seeing fantastic results. Now, again, that's somewhat anecdotal, but I think when you talk to surgeons, talk to soft tissue surgeons, we're having some of the same conversations around that early intervention could be a way to keep these dogs healthier for longer and avoid some of these long-term chronic changes. So whether that's the laryngeal saccules, whether that's a pneumonic disease, whether that's esophageal disease. So esophageal disease in particular, some of the research suggests that is a result of chronic negative pressure on the esophagus, and that is causing some of these issues ongoing. So early intervention could head off other concomitant diseases.
Yeah, I actually have a Frenchie patient dealing with esophageal disease, and that's what consulting with internal med and surgery, that's been the resounding message is let's fix the BOAS and see what happens.
Yeah, it's tough. It's these guys are tough guys.
Absolutely. Absolutely. And I think the early intervention surgery, it'll be really interesting to see where that goes, because I think that could also be part of that conversation in the exam room with owners to say, okay, instead of we're just going to talk about neutering your pet, we're going to talk about these other early interventions. Yeah. So we have to consider the surgeon that's doing this procedure, because it's a little more complicated now, and making sure that owners are prepared for something like that so they have a healthier dog throughout their life, theoretically, assuming that's where things go.
Yeah, and I think we have some of the tools for this. I mean, we already, for cardiac patients, we already do at-home resting respiratory rate, right? So teaching brachycephalic, extreme brachycephalic breeds to check their pets, respiration rate, and seeing if there are any changes in that, and or even just recognizing the signs. Is there increased, mucus? Is there just are they seeming to have issues outside exercise, and like just trying to make sure they know these things, and then saying, is this a good candidate for early surgical intervention, and either consulting with a surgeon? I think those are great options. Yeah.
Absolutely. Well, Dr. Benson, really powerful conversation. I mean, like I said, my head is just spinning with, not normalizing these conditions, but also making sure that we're having good conversations with owners and we're supporting healthy breeding and the ways that we can do that, and where it's all going to go from here. It sounds like there's a lot that's going to develop over the next few years. So thank you for joining me and kind of giving us this initial insight into what we're seeing with these extreme brachycephalics.
Awesome to talk to you.
And thank you to Nationwide for partnering with us for this edition of Vet to Vet. Check out NABC's vetfolio.com for more of our V2V discussions on various topics in veterinary medicine. And remember, if one animal is better off because of you today, it's a great day.